I am Eleni, and this is the Mamamoo Podcast, a podcast I created in 2019 to give a platform to the many voices and personalities on the island who are creating, building, and generating change and progress. Today, I am joined by accomplished acupuncture clinician Dimitri Boules, because yes, we're talking about acupuncture. Before I sat down with Dimitri for a chat, I was offered a chance to try out acupuncture at his clinic in Larnaca. After filling in a questionnaire, ticking all the boxes that coincided with the various ailments I have, from minor ones such as migraines and neck and back tension to IBS and hormone imbalance, I visited the clinic and had my first session. Dimitri gave me a little but very effective neck and shoulder massage, followed by some cupping on my upper back, and finished our session off with some acupuncture. No, it didn't hurt, and yes, I felt a lot better after my appointment. And even for a few days following my first session, to be honest, I immediately booked a second one, which I have attended since then. And now I am planning on a third session, seeing as I feel my body has responded to the treatment in a positive manner. I have also booked an appointment with Dimitri's wife, Anna, who specializes in aesthetic acupuncture. Apparently, she has the ability to make her patients look 5 to 10 years younger via facial cupping, painless thin needles, and modern technology. So, expect another podcast on aesthetic acupuncture with Anna Boules soon. So, today with Dimitri, we talk about how acupuncture works, its impact on female hormones and reproductive health, on chronic disorders such as fibromyalgia, and if it works on kids, and how it helps the body heal. Without further ado, on with the show, on with Dimitri. Dimitri, welcome to the studio.
Thank you so much for having me. It's beautiful here. I love the fact that I'm able to be at the studio and see you again, but I'm also really excited that I get to explore a part of Nicosia that I've never been in. So.
The old town.
Yeah.
The old town of our hearts. Yeah, as I said before we put the microphones on, make sure when we're finished that you walk around. And any of you guys who come into the old town, just enjoy it. There's so much to do, and it's a different planet.
It is. It's just the buildings, the vibe,
no cars.
Yes, that's another really good thing.
Yeah.
You know, one thing I noticed here when I moved to Cyprus, I wasn't walking as much as New York.
Yeah.
And every chance I get to walk around, it's amazing.
Yeah. You don't need pavements in the old town, which is the problem in Cyprus. We have no pavements. Right, let's get to our topic, which is one that I have never, in the 6 years that I've been podcasting, ever touched upon.
Oh, that's great.
I think it's mainly because I didn't really find the right person, but also maybe because I feel that maybe acupuncture within the culture of Cyprus isn't accepted or recognized. It's just not
popular. I think that's the
probably
kind of like the better word.
Yeah,
because people just don't know about it.
Yeah. And so you decided to come to Cyprus, and you know, as I said before, this is a culture that doesn't really know much about it. So how did this decision come upon? How did you decide to make this move? And how's it been going?
Yeah. So about 5 years ago, my wife's from Cyprus. I was born and raised in New York, but my parents are from Greece, so I'm Greek. How did it come about? Well, I visited Cyprus in 2004, and from back then I loved it. I just there was something about it that drew me here, and we always thought, like in the back of our heads, like one day it would be a great idea to just move to Cyprus. And, as things progressed, we started having a family. We started working in New York. We would just come into Cyprus for vacations. And every time we would leave, we were just like, man, it would be amazing.
If only this couldn't just be a vacation.
Yes, yes. So long story short, it got to the point where in New York, it's a beautiful place. I love New York, but it's really hard to raise a family there. It's very expensive between taxes and just the cost of living. And we just weren't happy in New York, even though we loved New York. But once we changed this chapter in our life where we were married, we had kids, it changed things a little bit.
Creeps up on you though, doesn't it? You don't expect it to, and it does.
Yes. So COVID happened, and that actually, the good thing with COVID, I want to say, is that it gave me and my wife time, and actually a lot of people, I think, time to think about things, because we were just home. We didn't have anything to do. We didn't have to go to work. We were just home, and it just gave us that time to think and that clarity. And that's what we did. We just thought about it with my wife, and we decided to make this move, even though we knew we were prepared it was going to be very difficult. Because we were established, our business was there. I was teaching at a college at the time. I was teaching seminars. So we were very busy and successful business-wise. But we just weren't happy. So we ended up moving to Cyprus, and definitely it's been a lot of challenges, but it's
interesting,
also,
huh?
It's also been very, very, we're very happy here. Our family's very happy, and that's what's really important.
Yeah, it is. Well, happy wife, happy life, happy kids and all that. Yeah. So let's get to the basics of acupuncture. I don't know if you want to quickly explain what it is.
Sure.
And then not so quickly explain how it works.
Yeah. That would be great. So acupuncture is actually part of traditional Chinese medicine. This is an ancient form of medicine. It's still practiced today. It's probably the only one that's still practiced today. And the under the umbrella of traditional Chinese medicine is acupuncture, is herbal medicine and nutrition. It's movement through exercise. And it's also body work, which we call Tui Na, which is a form of medical massage where we do a special type of massage, and as well as bone setting, where we put bones into place.
Okay.
So under the umbrella of traditional Chinese medicine is acupuncture as well. And how does it work? That's a very common thing. So I'll give you the traditional explanation. I'll give you the more modern medical explanation.
Okay.
So the traditional explanation is that there's this thing called qi that moves throughout the whole body. And if there's a blockage of this qi, the body doesn't function properly. And when it doesn't function properly, it has symptoms. And a group of symptoms is a diagnosis, right?
Okay.
So there are imbalances in the body, and people can either feel pain or they can have other symptoms. Now, the more medical kind of explanation, if you will, is that acupuncture helps stimulate the nervous system. And when we stimulate the nervous system, we regulate the nervous system, the body can function better.
Okay.
And we get also a release of endorphins. Endorphins are really important to help reduce pain.
Yeah.
So if someone comes in with knee pain or lower back pain, neck pain, headaches, migraines, because of the endorphin release and the balancing of the nervous system, the patient feels much better. Their symptoms go away. They reduce significantly. And they live just a healthier lifestyle.
Okay. The qi that you mentioned earlier, is that the energy?
Commonly, a lot of people call it energy.
Okay.
But it's an incorrect way of explaining what qi. There's no direct translation from Chinese qi to English, for example.
Okay.
But what a lot of the people try to explain it as or what the ancient Chinese physicians tried to explain is breath. Just like Hippocrates was talking about pneuma, right?
Yeah.
Talking about breath. The same thing with the ancient Chinese physicians. They thought that this breath that we would take in would go into the lungs and then transfer to the rest of the body.
Okay.
Because the ancient physicians knew a lot actually about anatomy, believe it or not. They knew about these things that are nerves that are going from the spine all the way down to the arms and the legs.
Okay.
They knew about the blood vessels that were going from the heart all the way down to the extremities, to the arms,
Wow.
to the whole body. So their belief system was that if people do these breaths, that it would go into their body and travel to the rest of the body. And that's healthy.
Yeah.
But if there's a blockage and this circulation doesn't happen, then we have problems.
Okay. Is that blockage tangible? I mean, if I was to X-ray, I don't know, or MRI or CAT scan the body, could I see it?
Well, the theoretical part with what the ancient Chinese used to say is that you couldn't see it because you can't really see that qi, the substance, right?
Yeah.
However, we know now that blockages could happen like in diabetes, right? Like if somebody doesn't have good proper circulation because of diabetes and they have neuropathies and things like that, there's no good circulation that's happening. So we can see definitely that. But before it gets to that point, the physicians had a really good way of understanding of how the body works.
Okay.
And they would explain and think that there's this blockage that they had to open up with the acupuncture.
Okay.
Yeah.
Well, first of all, I'm lingering on the word breath and breathing, because that is actually something that I've touched upon on the podcast many times. We don't breathe properly.
Right.
Why do we not breathe properly? Is it something that we're not taught? Do we have to be taught how to breathe properly? Is it the hustle and grind of every day? What is it? And then I want to go to the nervous system as well.
Yeah, well, I think it's a combination of things. I think that in our culture, in the Western cultures, we don't really think about breath that much. I mean, now we have things like, more recent, we have things like yoga, right? Where it talks about, they mention and they focus on the breath, right?
Yeah.
But those are Eastern type of
Therapies.
ways of thinking, culture. It's part of their culture, and China as well. When I was in New York, there were a lot of Asian people at parks in the morning. They would just do Tai Chi, which is the movement therapy I was telling you about.
Yeah.
And they focus a lot with their breath on how they move, and they're very conscious of it. And I think it's also what you said. It's like, a lot of people are just stuck in that fight or flight mode. They're breathing in their chest. A lot of times people develop neck tension because all of these neck muscles that shouldn't be our breathing muscles, they're working extra hard now to... That's me. That's me. Dimitri knows. As soon as you touched my shoulders and my neck, you were like, wow, what's going on here? By the way, just when I felt like your back and you felt all these knots, in Chinese medicine, those would be considered blockages, right?
Yeah.
So,
well, I can tell you without knowing a thing about Chinese medicine that was definitely blocked. The nervous system.
Right.
And also I wanted to mention that when I came for my session with you, you also mentioned the vagus nerve, is it? So the nervous system, it's a very sensitive system, isn't it?
Yes.
And it's not treated as, we don't consider it to be sensitive, but that seems to be the first thing that's affected, either by everyday life, stress, or ailments, or whatever.
Yeah, and the nervous system, the thing with the nervous system is that anytime it gets some kind of stimuli, it needs to respond to that, right? So if you go outside, for example, it's really hot, your body starts sweating.
Yeah.
We don't control that. The body just does it. It's a reaction. The nervous system is picking things up, giving the information, and then something happens. And that's the cool thing with acupuncture is that we are able to tap into that system.
Yeah.
And depending on how we stimulate the body, the points that we use, we actually have this specific response that happens.
Yeah.
And it's not like, I mentioned to you, it's not like the body saying, well, I don't feel like doing that now. Once it receives that information, it gives it off. It gives it back. Now, another thing is, because you mentioned how does acupuncture work?
Yeah.
So initially when someone comes in, I ask a lot of questions. Usually people fill out something online, like that gives me a really good understanding of what's going on internally.
Okay.
Because when this medicine developed thousands of years ago, they didn't have x-rays, they didn't have blood work, they didn't have ways to figure out what's wrong. So the physicians back then had to ask all these questions. they had to feel the pulse.
We'll get to that, and the tongue as well.
And look at the tongue. The
Yeah.
tongue's like a map. It's the only muscle that's not covered by skin. So by gathering all this information, I really already have a good idea on who's coming in and what their imbalances are. Now, we further ask some more questions. We identify what area of the nervous system needs a little bit of help.
Okay.
And our goal with the acupuncture is to help that nervous system, to help rehab it back into health so it can work the way it should. So then the body can do what it's supposed to do, which is to heal.
Okay.
The body is meant to heal.
Yeah.
Right?
So you're working with the body or
100%.
assisting the body.
100%.
Yeah.
Exactly. Whereas the way I kind of like the analogy I have in my head is that I'm helping the body, or an acupuncturist, for example, is helping the body, assisting the body to do what it's supposed to do. Whereas, medication, there's always a time and place for everything. Obviously, I'm not against medication or anything, but the medication is more like it goes in the body and starts like changing things up.
Okay.
It's not necessarily
working with.
It's kind of like telling it what to do. Do.
Okay.
Which again, it's necessary, and in some cases, it's needed. But it's also a really good idea to kind of think that way too. Like, what can I do to help my body do what it's supposed to do?
Yeah, and oftentimes we're looking for quick fixes, aren't we?
Yeah, it's part of the culture. It's part of like, I don't have time to feel sick right now, right?
Yeah.
So I have to. I have
That's
to
something
feel
that
better.
mums say a lot, Dimitri. I don't have time to feel sick right now. I'm the last person to feel sick, and if I am sick, it means I'm truly sick.
Yeah, unlike the men, which get the man flu.
Yeah, the man flu. I did have a question actually here. Maybe we can do that now about men and women.
Right.
I mean, you've been practicing and doing this for a long time. Have you noticed any major differences between, I don't know, the chi of a woman and the chi of a man? And do they react differently, or is this biology and it really doesn't really have anything to do?
Well, I think what I've noticed, and we can see this, it's very common that a lot of women get things like fibromyalgia and all these kind of conditions because their biology is more complicated. They have a menstrual cycle, they have the hormone changes all throughout the month. So yes, I see definitely more of those kind of issues with women, and I think again because it's not part of our culture, there's not a lot of things that women know what to do to support their body.
Yeah.
So just an example, in Chinese medicine, or people in China, because it's part of their culture, they cook on a regular basis based on what that person needs.
Wow.
Right? So if someone, for example, just gave birth, there are specific foods that they'll make that helps replenish that, what the Chinese used to call qi in the blood. They help replenish that, right? So in the Western culture in Cyprus and Greece, we've lost that. It was part of it.
Yeah.
People knew, but now it's like everybody's eating the same thing in the winter, same thing in the summer, same thing it doesn't matter really what time of the year. Whereas, in China, because it's part of their culture, they have seasonal eating. They'll cook foods based on if someone's sick, if someone has a cold or a cough, if someone's during their menstrual cycle or after their menstrual cycle, they have certain foods. So they use certain herbs a certain way.
Okay.
It's part of their culture, and they know it, and they use it. Yeah. And I feel like in New York, for example, or Cyprus, I feel like people just have lost that.
Yeah.
And the women unfortunately struggle a little bit more.
Yeah. Well, it's interesting with the whole perimenopause and menopause movements that are happening the last 10 years, that all of a sudden we're discovering things about our bodies that we had absolutely no idea about. Mm-hmm. And I do want to go into that as well, because that's part of the question. But can we go, that's another question that I had. Sorry, can we go to the tongue and the pulse?
Sure.
Why the tongue?
Yeah. So
what's that got to do with anything?
The tongue is like a map of the body internally. So the tip of the tongue, for example, corresponds to the heart. So just as an example, if someone has a really bright red tip, compared to the rest of the tongue, that's probably telling me that they may have maybe some sleep issues. They might have some vivid dreams. If, let's just say, the middle of the tongue, there's a thick coat compared to the rest of the tongue, that's telling me that there's some kind of digestive issue that's going on, because that's the digestive system.
Okay.
The sides correspond to the liver. So all those things.
So literally a map of the body.
Yeah.
Wow, okay.
It gives us information.
Okay.
Now, this is really important when it comes to helping people and maybe recommending some herbal formulas and recommending some foods. So if, we say this is very common with women. I had a patient that had what we call amenorrhea, which she wasn't getting her period.
Okay.
And one of the things that I noticed with her tongue, it was very pale. Very pale compared to what a healthy tongue should look like, which is like, if we look at a child's tongue, that's a healthy tongue.
Okay.
That's what it should look like.
All right.
So hers was very pale. She was also getting dizziness and all these other things. So I said, okay, in Chinese medicine, that's called blood deficiency. There's not enough blood in the system to help nourish her brain, to help get her cycle, to help actually, start the menstrual cycle, the period. So I gave her some recommendations. I gave her some food, a list of foods that will help build blood in the system. I gave her some herbal medicine recommendations that she took for a short period of time, and her cycle started again.
Wow.
Right? So that I wouldn't be able to get at any other way, just by but looking at the tongue, that gave me a lot of information what's going on internally.
Okay. And the pulse?
The pulse is also another one of those things, the different characteristics of the pulse. So as an example, if someone has a rapid pulse means like it's pretty quick, considering what we would call normal.
Okay.
So if that's pretty quick, that's telling us that there's a little bit of heat, too much heat in the body.
Okay.
So we want to have a balance. You've probably seen the yin yang symbol, right? The yin is more cooling, relaxing. The yang is more like high energy, faster, more warmer.
Okay.
So to me, if someone has let's just say a rapid pulse, that's telling me that there's a little bit too much heat in the body. So we need to regulate that. Then we need to bring down the heat. Okay. Maybe increase some fluids in the body so we can bring that balance back. Right? Yeah. Because if there's too much heat in the body, if you think about it, just like in nature, right? If there's too much warmth, just like in Cyprus, everything dries out.
Everything dries and goes brown. Yeah, exactly. You mentioned kids.
Yes.
Can kids do acupuncture?
Yes. Actually, my tent, he's 11 now. We've been doing acupuncture. He's been asking for acupuncture because he has growing pains now, and he has all these things. And he's like, Dad, can you massage me here? Can you do some acupuncture?
Yeah. So
yes, they could, as long as they're able to kind of stay there with the needles for a little bit. There's also an entire specialty of pediatric acupuncture.
Oh, really?
Absolutely.
I didn't know that. Okay.
Yeah. But that's a specialty. So in New York, because when you graduate the acupuncture program,
okay,
you can decide, if you decide, you can specialize in different things.
All right.
Some is fertility, others are aesthetic acupuncture or cosmetic acupuncture, like my wife has specialized in, and sports injuries. There's also pediatrics. So there's practices that focus just on children. Yeah.
Why would a parent be interested in bringing their kid into acupuncture? I mean, what would they notice? Is it behavioral issues? Is it maybe something physical? Is it what do you normally see or hear?
Well, I personally don't treat a lot of children.
Okay.
But a lot of times people or parents might notice that the child is not sleeping well, for example, or maybe they have some digestive issues, or maybe they're just having like some constipation and they're not able to go to the bathroom on a regular basis.
Yeah.
So there's also cases where people have their children have some neurological issues, so they'll do some treatment for that.
Okay.
So there's different things acupuncture can assist with.
Okay, so really there's no age limit, let's say. I mean, obviously you're not going to prick a newborn or
Right, so I would treat probably differently than my son, for example.
Yeah.
Yes, absolutely.
Okay. Okay, so you did mention fibromyalgia earlier, and I did have a follower send a question. Would you advise acupuncture for a patient with fibromyalgia?
Absolutely. So I'll answer that, but I think
Let's go back to the reproductive.
Explaining a little bit how, just in simple ways, how acupuncture works. I don't want to.
Okay. Well, one of my questions actually was not only how does it work, but how do I know that it's working?
Oh, okay, great.
Okay. All right. You can take it any way you want.
All right. How does acupuncture work? Just a simple kind of way. There's 5 mechanisms of how acupuncture works, and this has been proven through research. So it's not like just me saying it.
Okay.
But one is called the local mechanism. The local mechanism essentially is when we insert a needle into the body, around the area where the needle is, the blood vessels will open up a little bit more and increase blood flow, fresh oxygenated blood in that area. So that's great when someone has a tissue injury, like a muscle injury, a ligament or a tendon.
Okay.
It's fantastic because it helps increase one of my mentors calls the healing chemical soup. Right?
Ooh.
So we get a lot of things like substance P and glutamate and amino acids and white and red blood cells go into that area where there's the injury. There's nothing to fight there. There's no infection, but the body's like, well, I'm here. Let me fix this tendon
So I might as well
problem.
get to work. Okay.
Right.
All right.
The second thing is that when we have pain, that pain signals, let's just say from the knee, has to travel up to the spinal cord and then to our brain, and that's how we feel pain. Okay, so the pain is in the brain.
Yeah.
Not that we're crazy or anything, but the pain literally has to travel to the brain. The brain has to process it, and that's how we feel pain. Now, when we do the acupuncture, the signal is not just local. The signal will actually travel up to the spinal cord. And at the spinal cord, there's endorphins that get released. There's something called enkephalin and serotonin. Now, when enkephalin and serotonin, these chemicals that our body makes, which is amazing, when these chemicals get released, the pain signal that travels up through that area to go to the brain dampens. It reduces. So the pain signal is a lot less. That's why we have less discomfort, less pain, right?
All right.
Now, when we do acupuncture, again, it doesn't just stop at the spinal cord. That acupuncture signal goes all the way up to our brain, an area called the hypothalamus. In the hypothalamus, there's a release of another endorphin called beta endorphin, which is really good for fertility. It's really good to help reduce pain. But when that gets released, any pain coming from anywhere in the body diminishes. Wow. It reduces significantly.
Okay.
Now, the other thing that acupuncture does is that if we have damage, let's just say someone had a stroke, for example, right? And there's damage in the brain or in some part of the nervous system, we can actually do acupuncture around the area where there's damaged tissue, there's damaged part of the nervous system to help rehabilitate it back into health.
Okay.
It might not get to 100% as before, but there's definitely going to be some improvement where it's going to improve the quality of that patient's life.
Okay.
And the other way that acupuncture works is that if we have a tight muscle somewhere, like the knots that you felt, when there's a tight muscle somewhere and the needle goes into that area, it's like you press Control-Alt-Delete on the computer and it kind of resets the muscle.
Okay.
Or in this case, the muscle, but when we press Control-Alt-Delete and it resets the computer, it's going to help kind of reset that muscle so it relaxes. Okay.
Yeah.
And if you remember from the first mechanism, because we get that healing chemical soup there, not only is the muscle relaxing, but it's also getting the nourishment that it needs to function better.
Okay.
So just as like a kind of
that
quick
was needed.
way,
Thank you.
just to understand, because a lot of times, unfortunately, I hear patients come in and they say like, oh, they told me that acupuncture doesn't work, or they told me that it's a fake science, or that's not true. Acupuncture, it's well documented that it works. I mean, if the fact that it's been practiced for more than 3,000 years doesn't tell
say
us
anything,
that doesn't say that it works. It's but there's actually evidence, because of course we live in a society where we need to test things, and I agree with that. So and that evidence is available.
Okay.
So now when it comes to fibromyalgia, how can it help? A lot of people that have fibromyalgia, they also have other issues coming up. So for example, they have maybe some digestive issues, they have some sleep problems, they have issues with, maybe they're taking medication for anxiety or depression.
So it affects your life tremendously.
Absolutely. So what we're noticing is that these people are what we call chronic systemic.
Okay.
Chronic systemic versus mechanical. Mechanical is, let's just say someone falls and they injure their knee.
Yeah.
That's a mechanical problem.
Okay.
That's pain because of an actual
Specific
injury.
something, yeah.
But we also have these other people that have pain that is not mechanical, right? Their nervous system is out of whack, and they're getting a whole bunch of issues with their body, including things like fibromyalgia and pain everywhere in their body. So our approach is very simple. Let's reduce pain by releasing these natural painkillers that our body produces, and let's help regulate their nervous system so it's not on the fight or flight mode.
Wow.
Our nervous system has two parts. It has the voluntary, which means that I'm thinking, and my brain sends a signal to my arm so my arm can move.
Okay.
That's the voluntary part of the nervous system. But we also have an involuntary part, right? Or we call it autonomic, which we don't control.
Yeah.
Like our digestion, the production of hormones, the release of hormones, our blood pressure. We don't say, hey, I want my blood pressure to go down now, right?
Yeah.
So we have this automatic or autonomic nervous system that also has two parts. It has the fight or flight and the rest of digest.
Okay.
Or the fight or flight is also called the sympathetic or the parasympathetic, right? So what ends up, we need both. We need that fight or flight, because if let's just say there's a bus coming towards me, I need my nervous system to kind of react to that and get out of the way, right?
Yeah.
And we also need the rest and digest so we can our body can recover, can digest properly, and et cetera. But a lot of times people are stuck in that fight or flight mode. Okay. So we need to get them out. And when they're constantly stuck in that fight or flight mode, their nervous system is out of balance, and they can experience a whole host of things, including fibromyalgia.
Okay.
So let's tone down that nervous system so we can get them more in that restful state, and let's release a whole bunch of endorphins so they can feel better. And then along with other lifestyle recommendations, we can help them reduce their symptoms and live a much more comfortable life.
I like that you're not presenting this as just a one-hit wonder sort of thing, that it needs to be together with nutritional and other lifestyle changes. Yeah. I mean, when I came to you, before I left, I had an email with exercises that you recommended and foods that you recommended as well.
So one of the things I like to do with my patients or my clients is that the acupuncture, they come to me and I see them once a week, maybe once every 2 weeks, or whatever the case may be. It's really important what they do in between, right? Yeah. So if someone gets acupuncture and then let's just say for digestive issues, and then they go eat McDonald's, or
I was going to say, probably go off and eat a hamburger and some fries. Yeah.
If they sleep 4 hours a day, there's only so much we can do. Again, we're trying to help the body.
Yeah.
So we need to also create this better environment so the body can do what it's supposed to do. Plus, we can, with our treatments, help it even more.
Yeah.
And they can feel better.
So another question was the impact on female hormones and reproductive health. And since we're talking about female hormones and reproductive health, maybe you could also explain, when it comes to menopause, if and how acupuncture can help.
Yes, it can, for sure. And the great thing with acupuncture, it has this regulatory effect, meaning that if something's too high, acupuncture will help kind of bring it to normal levels. If something's too low, it's also going to help bring it up to normal levels. So when it comes to menopause, it's not one specific, a specific protocol that we do. We might have 3 women coming in with menopausal, the diagnosis of menopause. Yeah. But those 3 women are probably going to get a different treatment because their body and their symptoms are going to be different.
Yeah,
They might have the same diagnosis.
But I was going to say also the symptoms of menopause, there's like 30 or 40 or 50
Right.
on the list. I mean, it could be anything.
Right.
Yeah.
Right. And some people, some women might have issues with sleeping. Some don't have an issue with sleep. They sleep great. Some might have excessive sweating.
Yeah.
So
Weight gain.
Weight gain.
Yeah.
It could be their cycle is sometimes it comes, sometimes it doesn't.
Yeah.
Sometimes it stops in the middle and it starts again after 3 days.
Messes
right?
you up, man. Yeah.
Right. So digestive problem. That's another thing. Bloating around with perimenopausal. So again, we want to treat that person in front of us. We don't want to treat a diagnosis. So we ask. That's why we ask the questions. That's why we look at the tongue, feel the pulse. We create this tailored treatment for them and lifestyle recommendations that all are going to work together to help that person feel better.
Yeah. Okay.
This is unique to, especially now, it's very unique because we don't treat everybody the same. We want to individualize the treatment so we can get the better results.
Yeah.
Because if you start treating everybody the same, some people are going to react okay. Some people are going to have a bad reaction.
Yeah.
Some people are going to see no difference, right?
Yeah.
So this is where I think this is one of the strengths of traditional Chinese medicine is that we can able to tailor things based on what the person actually needs.
Yeah. How long do sessions last?
So the initial session, because we have to go through an assessment, right, where we ask the questions, look at the tongue, feel the pulse, that might be like around 45 minutes, maybe an hour. It depends on what that person needs, right?
Okay.
So the first one is a little bit longer, and then the follow-up visits, because we know it already, we know you, right?
Yeah.
Or we know what the issue is, what we're tackling.
Yeah.
We go right into it. Maybe it's like 30 to 40 minutes.
Wow.
Right?
Okay.
Again, because sometimes some of the patients might need the body work, right?
Yeah.
Like we did together.
Yeah.
After the acupuncture, sometimes people just need a little bit extra time with the needles. So it really depends on what that person needs, but it's around there.
Okay. Well, seeing as we did mention my session, and we have to say we did the body work, we did the acupuncture, we also did cupping.
Yes, we did ear seeds.
And we
right?
did the ear seeds as well, which I pulled out. I was cleaning my ears and I completely forgot that it was in there. And I went, but I had them in for like 3 days. So, yeah, cupping.
Yes.
Is that something completely different, or
No.
is that in tangent with?
It's part of Chinese medicine.
Okay.
So there's the Tuina, which is the medical massage, also has these tools, right, that we incorporate. So cupping is one of them, and we can use cupping for different things. There's some cases where sometimes somebody might have an injury, there's lack of blood flow into an area, and if we put a cup onto that region or onto that area, it helps increase blood flow to that region.
Okay.
Because cupping does something called angiogenesis, which means that agio is the capillaries, the blood vessels. Genesis is the creation. So it creates more blood vessels in that area, which will help with the circulation.
Okay.
In your case, we put some oil on your back, and then we put the cup and we moved it around. So it's like a reverse massage, right? Instead of me pushing down on your tissues and actually maybe even feeling uncomfortable or a little bit painful, the cup actually helps separate the different layers of tissue between your skin and your muscles, separated those layers that are all stuck together, and helps loosen everything up, opens it up, so we get better blood flow into that area. We get waste products coming out. And if I remember correctly, your back got red, right?
Very red.
Yeah. So one of the reasons why it gets really red is because there's a lot of what we call stagnation. So there's that the qi that the ancient Chinese physicians used to say is stuck. The qi also moves blood. So if the blood is kind of stuck there for a long period of time and then you do some cupping, you get this redness, sometimes purple color that comes up.
Yeah.
It's because this old blood, quote unquote, comes up into the surface.
Okay.
And the body will get rid of that.
Yeah.
So, yes, so we did the cupping. And then we also did the ear points, right? So the ear points, we use it
which is something that you put in my ears and I was allowed to go off with them.
Yes, there's special super tiny needles with a little sticker that we put onto specific points. And what we're trying to do, in your case, we try to stimulate and regulate the vagus nerve. So the vagus nerve, a lot of people are talking about it now online. There's even like little devices where you can stimulate the vagus nerve. You can purchase them and stimulate the vagus nerve. But the vagus nerve is one of those nerves that helps keep us in that restful state, the parasympathetic state, not the fight or flight mode, right? So when the vagus nerve goes to the heart, the lungs, and the intestines, and it exits our brain. So this is what a special nerve, because it's what we call a cranial nerve, which means it exits the brain, not the spinal cord. It exits the brain, and it directly goes into the various organs.
Okay.
So you've probably heard like the connection between the gut and the right?
brain. Yeah.
So by stimulating and regulating the points in the ear, we can help stimulate the vagus nerve and regulate it, which is going to help with a whole host of things, including keeping us nice and calm in a restful state.
Yeah.
And we have better sleep, better digestion, our blood pressure is normalized, and the list goes on.
Okay. Another question that I had here was, can it be used in conjunction with conventional medicine?
Absolutely.
Yeah.
Absolutely. So we actually have cancer patients right now that are going through chemotherapy, radiation, and what we're doing with the acupuncture is to help improve their quality of life. We're helping improve and help with their immune system, because unfortunately with chemotherapy, the immune system gets...
It's almost non-existent.
Yeah. And there's research that actually shows that there's a point by the knee called stomach 36, which increases red and white blood cells, which is very important, because if those numbers, right, the blood levels are low, what ends up happening is that patients that are going through chemotherapy, they have to stop the chemo until those blood levels normalize, and then they start again. Now imagine... I would imagine if someone's going through a treatment like that, they want to get done as soon as possible, right?
Yeah.
You don't want to drag it on for a long time. So when we do acupuncture, one of the things that we do for those kind of patients is that we try to keep those blood levels up, so they can complete their chemo as soon as possible.
All right.
And then, unfortunately, with chemotherapy and radiation, there are certain side effects. So some people might have nausea, vomiting. Some people might end up having depression, anxiety. Yeah. Some patients, I have a patient right now, her tendons are hardening so much and they're getting so tight, she's getting something called trigger finger, which essentially she can't really open up. She has to pry open her hands to open up her hands.
Yeah.
I have another patient that's going through chemotherapy right now. They have something called neuropathy, which is numbness in her feet. So when she goes to walk around, she can't feel the floor, and unfortunately, she can fall, right? Yeah. So there are different side effects, unfortunately, that come up. I have another patient that has xerostomia, which is a dryness of the mouth. Which, you don't think of it, but it's like these things they affect the quality of life, right? So, yes, acupuncture can be used in conjunction with what we call Western medicine. Yeah. And, a lot of times people, they think because I'm an acupuncturist, I'm against Western medicine or anything like that. But that's not the case. I think there's a time and place for everything. Yeah. I've had a patient, for example, that came in. He's my neighbor too, and he came in. He had what we call sciatica, which is nerve pain that goes all the way down from the lower back to the foot,
which is quite common, isn't it?
It's common. Yeah, it's common. And in his case, it was so severe that he lost the function of his foot.
Oh my God!
So he couldn't raise his foot to walk. And when he came into the office, I was like, I can't do anything for you. You have to go to the neurosurgeon. Like yesterday. Yeah. And thankfully now he had the surgery, and now he's walking again, he's moving again, and he's going to come back to help with some numbness that he still has after the thing, but he's able to function again.
Wow.
So just wanted to clarify, that there's always a time and place for everything. Yeah. We don't want to be, obviously.
Yeah. So physiotherapy was another question I got. Some people say, but, I've tried acupuncture. I did it at my physiotherapist. Is that the same?
No. So
what's the difference?
physiotherapists, I have relatives that are physiotherapists, so I'm not against them. I don't want this to sound like anything, but anything negative. But physiotherapists use an acupuncture needle to reduce any kind of tightness in a muscle. So if a muscle is really tight, if you remember, one of the mechanisms is that when a needle goes into that muscle, it's the Control-Alt-Delete, and it helps relax the muscle.
Yeah.
That's what they learn, which is like usually a weekend course. It's not extensive education on acupuncture and Chinese medicine.
Okay.
Our education is different, obviously. So we focus more on, regulating the entire nervous system. We treat far beyond just tight muscles.
Yeah.
It's extensive, the education. It's actually, in New York, it's minimum of 6 years to become an acupuncturist. So, and it's a doctorate degree, so it's not even.
Yeah.
So it's different. It's different. And what I say, again, I don't want this to sound negative, but if you need a plumber, you're going to call a plumber, not an electrician, right? The electrician might know what the pipes look like, but I don't think I would trust an electrician to create a whole piping system for my new house, right?
True. I see what you mean.
So we want to use the healthcare providers correctly and in order to get the best and the safest results. Because if, let's be honest, if somebody, at least for me, I would prefer to go to someone that has quite extensive education and experience using a needle, right, on my body, rather than someone who, maybe had maybe a weekend course, right? So again, they're really good at what they do. So it's not that they're negative or anything. They want help. That's why they're learning these things.
I was going to say to me, because I've been to a physiotherapist and had the needlework done. It's almost like it's just in a way to assist what they're trying to do. It's just one way of the many. Because then you have, I've done various things at physiotherapy, which do not include hands-on work.
Right.
So I figure it's just another addition to the field. That kind of helps them move things along.
Yeah. But
it's just one of many, whereas it's not.
It's not the main thing.
It's not the main thing. With you and acupuncturists, it's the thing.
Yeah. And actually, since you've had experience with me and you have experience with, I'm sure.
Yeah. No.
There's a difference, right? You felt a difference?
Massive. Massive difference. For sure. So one of the questions that I had was, how do I know if it's working? Mm-hmm. How do I know if my body is responding to acupuncture?
Yeah.
Do I have to give it time? Are there some things that I will notice? Or is it probably non-notable? You just all of a sudden feel better?
Yeah, so everyone is different. Some people, and their conditions are different.
It depends on the condition as well, obviously.
Yeah, if somebody wakes up and they wake up with a stiff neck, they've never had it before, and they come to my office, they'll usually need just one treatment, and we knock it out. Their neck's much better the next day, and they're fine, right? Now, if someone has fibromyalgia, right, that person, especially if they've had it for a really long time, which typically they do, that person might need a series to see a big difference.
Okay.
And what we usually do is after a certain amount of sessions, we do a reevaluation. So during the first initial session, we ask all these questions and we get this benchmark. We see where the patient's at. We do a couple of sessions and then we do a reevaluation to see the changes. And obviously we want to see some positive changes. And most people will come and they'll say, even after just one session, they're like, oh my God, I slept so well, or my digestion's improved so much. My period came, I didn't even know. Usually I get cramping, breast tenderness beforehand, but it just came. I couldn't believe it, right? So, there are going to be some subtle changes. Some people have dramatic, quick responses. Everyone is different, but we always want to see progress.
Yeah.
Okay. So that's why we do our reevaluations.
Okay.
We want to see changes.
Okay. So is there anything else that I forgot to ask, maybe, that you get asked often that we should
Does it hurt? I mean, that's one of the things.
Well, I was assuming that my that my listeners are gonna know that it doesn't hurt. There's
shouldn't
some
hurt, I should say.
discomfort.
It shouldn't hurt. So that feeling that you feel, that you felt, is what we call the Da Qi sensation. So in Chinese medicine, I think the translation is called the great sensation. Now, this is really important because in the ancient Chinese medical texts where they talk about acupuncture, they mention that term over 150 times.
Oh.
Yes, and that's significant. So when something, just like in like any kind of ancient text, right? If something's repeated over and over again, that means it's because it's important. Right?
Yeah.
So the Da Qi sensation, what is it? They actually say that the doctor and or the patient need to feel the Da Qi sensation in order for the treatment to be effective. And if the patient and the doctor don't feel the Da Qi sensation, the treatment is rendered useless, which means that it's not going to do anything.
Yeah.
Exactly.
Yeah.
So what is that sensation, right? So we know now through neurology is that when we insert the needle and we have this like this either little pressure or
kickback,
or the grab. We call it the grab sometimes, or the twitch. What ends up happening is that we make that really nice connection with the nervous system. In order for you to feel that, it has to travel to the brain. You remember how we said that signal has to travel to the brain. The brain registers it.
Yeah.
So I know now that when I get that little sensation and that you feel and that I might feel through the needle, I made that really good connection. So when I do the treatment, the effects are going to be greater.
Okay.
Yeah.
All right. So it doesn't hurt.
No, it doesn't hurt. No.
Yeah.
The other thing that a lot of people might mention is that they've had acupuncture in the past, but they've never had the electroacupuncture.
We did that as well. Yeah.
That's something unique that we do in our practice. Because what we do is that we take the traditional Chinese medical model and we combine the modern medical sciences together, right? So we know that when we add an electrical current, we can actually target a release of certain endorphins, which help reduce pain. They help with other things, fertility as well, like we mentioned. We know that we can also reproduce treatments over and over again, right? Because I'm putting in when we do the needling, I'm putting the electrodes onto the needles, and that's constantly sending a signal to our nervous system.
Okay.
And like I said before, anytime the nervous system receives a signal, it has to respond to it, right?
Yeah.
So what's unique with our clinic is that we use the electroacupuncture on a regular basis because we get better results and we are able to reproduce those results every time a patient comes in to the office.
Okay.
Yeah.
Wow, I don't know how many times I've said wow. Also, it just clicked. You mentioned Anna, your wife. You said she does aesthetic.
Yes. So
I need to try that as well.
You're gonna love it. If you think I'm good,
what is that?
Anna's gonna be. Yeah. So I want to just.
And I promise, guys, I'll bring her in as well. Let's just find out what it is first. Yeah.
Well, Anna's, first of all, I want to say that Anna's the reason I'm an acupuncturist. Number one, because she's really. I mean, she's brought so much joy in my life, but this is one of the things that she's kind of guided me when we were younger. She was an esthetician back before we were acupuncturists. She was an esthetician, and she saw this morning show where they were doing acupuncture for wrinkles.
Wow.
And I'll tell you how it helps. So she's like, oh, this looks interesting. Maybe I can combine it with my aesthetic work and help reduce wrinkles. Now, she thought it was kind of like a weekend course type of thing. Like she was just, right?
Yeah.
So we met later we were girlfriend, boyfriend at the time. We met later that day and she said, I saw this. This was very interesting. I'm like, well, why don't we go check it out? Maybe we could check out a school and you can start.
Get started. Yeah.
And long story short, I drive her literally the next day, and I had a car, so I drove her to the school, which we didn't know it was an actual degree.
Actual school.
Yeah. So we go in there thinking it's like this weekend course, and we started talking to this advisor who was amazing and explained what acupuncture is and how it's minimum of 6 years. You learn not just acupuncture, but also herbal medicine. You learn movement therapies. You learn body work, like the Tuina, the medical massage I was telling you about. And when I was listening to this, I was like, all these lights were like, oh my God, I was getting blown away.
You found your calling.
Yeah, and I turned around after we were there for about an hour, and we got a tour of the school. The energy of the school is amazing. I'm like, wow, this is it. I just turned around, and I was a personal trainer at the time, and I was like, if you sign up, I will sign up with you.
Okay.
And we're going to do this together. And literally that day, we signed up with no prior experience with acupuncture. We signed up, and not only we signed up, but I'm a little, back then especially, I was a little impatient. So the 6 years was like a lifetime for me. There was so many times that I was like, I'm going to quit. I'm not going to do this. I'm going to go back to training people, what I knew, what to do. And she was the one that actually helped me stick with it. And yes, so that's how
you both got into it. Okay,
became acupuncturists.
Nice story.
Now, what is aesthetic acupuncture? So aesthetic acupuncture helps treat not only the face but also internally, because Anna believes that when you're healthy inside, your digestive system's functioning properly, you emotionally feel good, it's going to show in your face, right? So she treats not only the skin, but she also treats the body.
Okay.
And she also looks at, improving things like fine lines and wrinkles, because when she does acupuncture on the wrinkles or the fine lines, the body starts producing collagen in that area and fills up the fine line of the wrinkle. After the age of 30, collagen reduces significantly. So by us doing that, targeting those areas where it needs a little bit more collagen, it helps fill up those areas so the fine lines get eliminated and the deep wrinkles will fill up a little bit more.
Okay.
So the other thing that Anna does, of course, is if there's any kind of puffiness around the eyes or in other areas, she helps do special techniques to help drain that.
Wow.
If
so that's
dryness,
kind of like lymph drainage as well.
Yes, yeah.
Because I've got that. Yeah, I get puffy, and I know that my lymph nodes are just all blocked. Mm-hmm. So Anna, I'm coming for you.
Yeah, she uses different things. She also combines the traditional acupuncture with the modern aesthetics.
Okay.
So she uses in combination light therapy to help with the production of ATP. ATP is essentially the cells of the energies in the cell.
Yeah.
So when the cell has more energy, it can function better. It can recover, rejuvenate much faster. She uses all natural organic skincare products to help enhance her treatments.
Okay.
And then she also gives some dietary recommendations if someone has cystic acne, for example, or if someone has rosacea and things like that. Again, a holistic way of addressing the skin. And, it helps women that maybe don't want to do things like Botox.
I was going to say, this sounds like a lovely alternative to people like me who do not want to go down that road. But on the other hand, every day you wake up and you look in the mirror and you're like, I'm over 40 now, I'm 45. I see some changes. It's difficult to adapt a lot of times to what you're seeing and the changes you're seeing. And you don't want something that's majorly dramatic, but at the same time, you know that you need something.
Yeah. And
whether
she can guide you on what needs to be.
And you both work out of the same clinic.
Yes.
In Larnaca. So to end this, if someone wants to contact you, how can they do it? I will put all the information in the show notes. Is there something that they need to prepare for before they contact you? So just a message to the listeners who are interested in coming.
Prepare to feel great. That's what I usually tell people. Because we do our assessment and our evaluation, we don't really need much. We just want you to come, and maybe just fill out the paperwork before you come in, so we don't waste any kind of time with that. What was the other question? I'm sorry.
You can. I was also going to say, how can you book and do the process? I was going to say there's an online booking option, which I found tremendously helpful. The same with the questions, ticking the boxes online.
Yeah, so we have a website that has a lot of our information on there. We also have blogs on our website if somebody has a specific area or a condition they would like to learn a little bit more on how acupuncture and the style of acupuncture that we do, how it can help them.
Okay.
We have articles on depression, tendinitis, anxiety, sleep, a whole host of things, which also have tips that people can start implementing now before they even see us.
Okay.
They can book online on our website. They can give us a call. I'll give you the info. We also have a good presence on Instagram where we try to share what we do in the clinic and how we can help people and tips and tricks that can help enhance somebody's health.
Okay.
And just one thing I do, one thing, if the listeners can kind of leave with one thing, there's one book that I really like, and it's called Rays of the Dawn by Dr. Fleet. He was a very famous doctor back in the 1930s, and he had a list of something called the laws of the body, which if we follow and we obey these laws, our body's going to function and be healthy, you know, or reverse even a lot of health issues that people might have.
Okay.
So one of the things he talks about is the different laws. So the law of nourishment, making sure that we eat whole foods, healthy. We want to eat foods that are specifically going to be good for us, right? It's that tailored treatment that I was telling you about. We want to obey the law of recuperation.
Yeah.
A lot of times we think of recuperation only sleeping at night, which is important, but it's not the only thing, right? We need also that recuperation part is also resting throughout the day.
Yeah.
So if we feel tired, it'll be wise to take even 5-10 minutes to kind of put things down a little bit and just say like, okay, let me just maybe shut my eyes.
Yeah.
Not necessarily to sleep, just to relax.
Yeah.
Just to kind of reset.
Yeah.
And then the other part of the law of recuperation is recreation. Finding something fun to do.
Yeah.
Because a lot of times we just focus on work, we focus on driving kids back and forth, and all these responsibilities that we have, and we kind of don't do anything fun for ourselves, and that's important.
Yeah. We focus on being productive, right, Dimitri?
Yeah.
We always want to see an end result where it's never just, oh, let me just sit and daydream, or let me just paint a picture, or let me just literally do nothing.
But we can be productive. Sometimes we are busy, not productive. Like you can be busy and not do anything.
That's true.
Right?
Yeah.
So putting that time to be productive and then saying, okay, I did what now I'm going to do something a little bit different.
Yeah.
I'm going to use different parts of my body. I'm going to use different parts of my brain to do this recreational activity that I love to do. Right?
Yeah.
So it's recuperation, nourishment, the law of movement. So we need to move our body, whether that's, for some people, it's just walking. Some people it's going to the gym. Some people it's yoga. Whatever the case may be, you need to move the body every single day. Keeping the law of sanitation, keeping the body clean, right? But it's not just the body, it's also the mind. We don't want to have these negative thoughts on a regular basis.
Yeah.
We need to think positively, even though there's a lot of stuff going on in the world right now. We need to stay positive.
Yeah. I think people are thirsty for positivity, right, Dimitri? And happy news and good news.
Yeah.
It's like they just, the moment that you hear something good, you're like, oh.
Yeah.
Oh, that's so amazing.
I do this thing when a patient comes in, and I say, "What's good and new?" And they look at it's like almost like they get like confused.
Yeah,
they're like, "Wait, what?"
What?
I'm like, "What's good and new?" Because now you can't say something bad, right? You can't say, "Oh, there was so much traffic,"
exactly.
because that's not good. So they have to think about it, and so maybe
that's a good one, actually.
You can say what's good and new.
What's
from
good
now
and
on.
new? Yeah. Can you mention the name of the book again? Because we love book recommendations here, and I'll put it in the show notes as well.
Yes, it's Rays of the Dawn by Dr. Thurman Fleet.
Okay.
It's one of my favorite books. He was a doctor. He was a chiropractor actually in I think he was in San Antonio, if I'm not mistaken, in Texas, and his clinic was so busy that the police had to reroute traffic because he would cause so much congestion in the area of people, coming to see him.
Okay.
So imagine now you have a clinic here, and like you have the police telling people you got to go around this way because there's too much traffic.
Wow.
Here.
Okay.
So this he had a whole bunch of pamphlets that he was giving to his patients, and he ended up putting all those pamphlets, all that information into the book, and that's where that book came from.
All right. Okay. So I will put all the information that you guys need to contact Dimitri or Anna, and I will try to bring Anna on as well at some point. Thank you, Dimitri Mo.
Thank you so much for having me.
So much for coming and answering all these questions, and I look forward to seeing you next week.
Yes.
Because I've booked my second appointment.
Yes.
So thank you so much.
Thanks for having me.